Childhood is meant to be a time of wonder, discovery, and joy. But for many children, it's a time of trauma, fear, and uncertainty. Adverse childhood experiences, or ACEs, can have a profound impact on a child's life, influencing their mental and physical health, relationships, and overall well-being. Now, I've seen firsthand the devastating effects of ACEs during my time working at an inpatient psychiatric hospital for children and adolescents. I witnessed how traumatic experiences can shape a child's behavior, emotions, and relationships. It was heartbreaking to see young children struggling with anxiety, depression, and behavioral issues, all of which were connected to ACEs. ACEs refers to traumatic events that occur during childhood, such as physical or emotional abuse, neglect, parental substance abuse, domestic violence, parental incarceration, and parental mental health issues. These experiences can be devastating for children, and the effects can last a lifetime. ACEs can increase the risk of anxiety, depression, post-traumatic stress disorder or PTSD, suicidal thoughts, substance abuse, and eating disorders. Children who experience ACEs may also struggle with emotional dysregulation, difficulty trusting others, and forming intimate relationships. And these effects can last a lifetime, which will influence relationships, such as difficulty trusting others or forming intimate relationships. Also, career choices, decreased academic and professional achievement, physical health, increased risk of chronic diseases such as diabetes and heart disease, mental health, increased risk of mental health disorders and substance abuse. ACEs can also affect a child's brain development, leading to changes in the structure and function of the brain. Yes, research has shown that traumatic experiences, especially those occurring during critical periods of development, can lead to physical changes in the brain. These studies have found that trauma can affect the development and structure of various brain regions, including the amygdala, hippocampus, and prefrontal cortex. Now, the amygdala acts as the brain's threat detector. It constantly scans our environment for potential threats or dangers. It's also an emotional processor. It helps process and interpret emotional information, especially fear and anxiety. And it's also a memory creator. It helps create and store emotional memories, especially those related to traumatic events. An overactive amygdala can lead to excessive fear and anxiety responses, even in the absence of real threats. It can lead to a state of constant alertness, making it difficult to relax or feel safe. And it can also lead to difficulty managing emotions, leading to mood swings and emotional reactivity. The hippocampus helps us create and store memories, while the prefrontal cortex helps us make decisions, solve problems, and regulate our emotions. Children who have experienced trauma may exhibit mood swings, irritability, exaggerated startle responses, difficulty sleeping, avoiding people, places, or activities that remind them of the trauma, feeling disconnected from their body or surroundings, or reverting to earlier childhood behaviors. Some children may act out aggressively towards others. It's essential to recognize these signs and provide supportive relationships to help children heal. Trauma-informed care is essential for helping children heal from their trauma. This approach acknowledges the presence of trauma and provides a safe, supportive environment for children to process their experiences. There is hope. By acknowledging the impact of ACEs and providing supportive relationships, we can help children heal and break the cycle of trauma. Prevention, treatment, and recognition. Prevention is key, and recognizing the signs of trauma and providing early intervention can make a significant difference. Treatment options such as therapy and counseling can also help children process their experiences and develop healthy coping mechanisms. You can make a difference. As a parent, caregiver, or concerned adult, you have the power to make a difference in the life of a child. By being a supportive and nurturing presence, you can help mitigate the effects of ACEs and give children the best possible chance to thrive. If you or someone you know is affected by childhood trauma, there are resources available to you for help, and you will find them in the video description. That's it for today's video. Be sure to like and subscribe for future content on child and adolescent mental health. See you in the next video.